Hello everyone, it's Coach Chris from Fortune Management of Nebraska, answering another top 10 questions we got in 2019 about how to run our practices a little bit better. One of the big questions we got was around treatment enrollment, and it's a big question and a little more difficult to answer. So we'll actually be answering it in two parts. One part, which is today, is going to be the clinical portion, and then the second part at a later time will be the front office portion. The clinical portion is we present treatment in the operatory, whether it's the doctor's op or the hygiene op, and then what happens from there. Oftentimes we walk up front later on in the day and said, hey, did Joyce schedule for her treatment? And the front's like, no, she had to go home and check her calendar, or no, she had to go home and talk to her husband. Honestly, most of that lands on us, the clinician. We didn't create enough value around what Joyce needs to be able to get Joyce to schedule. And that's what we'll be addressing a little bit today. There are 4 parts in the clinical operatory to treatment enrollment. Part 1 is identifying the need. Joyce, there's this crack. If you have a picture, this is amazing. 67% of our population is visual. You show them a picture of that crack, and you're going to have treatment enrollment pretty darn quickly. So telling Joyce, here's the issue, here's our concern. That's number 1. Number 2, what happens if she doesn't do it? Let's give Joyce the consequences. This tooth could break. This tooth could break and become more expensive or more time consuming. This tooth could break and need to be extracted because we can no longer repair it. Part 3, be the solution. So we've identified the need. We've stated the consequence. Now we need to be the solution. Joyce, it's a wonderful thing we caught this when we did. Dr. Smith is amazing. He can actually do a crown for you in 1 day. So that's wonderful. The last thing, which we tend to fail on a little bit in the back, usually because we're in a hurry to get to the front, is get the commitment. Joyce, what questions can I answer for you? That is a very powerful question. When we ask, do you have any questions? It makes our patients feel that if they do have questions, they might be stupid questions. Or if they have questions, then they're kind of not very bright for having questions. But if we ask, what questions do you have? That opens up the door to, oh my gosh, what questions do I have? And they may ask you questions about how long it's going to take. Most often we'll hear, how much is that going to cost? Or can this wait till my next visit? Having your doctor give you a timeline is huge in the operatory. I need to see Joyce in the next 3 to 5 weeks. Gives us a ball of power to take to the front and deliver. Front office, Dr. Smith said he needs to see Joyce in the next 3 to 5 weeks for the treatment on the upper left area. That will give us the opportunity to say, again, Joyce, what other questions do you have for me? None. Great, I leave you in great hands. The front can now take that and schedule Joyce's appointment. If the front office gets questions on actual treatment, we have not done our job in the back. I'm going to repeat that. If the front office gets questions on treatment, we have not done our job in the back. The only questions the front office should have to deal with is when and how to pay for it. That's really it. Let's get you scheduled. Here's how we're going to have you pay for this. Everything else should be taken care of in the clinical setting. Well, thank you very much. Part 2 will be coming with what front office does with that treatment enrollment. And have a wonderful, wonderful day.